When was the last time you had your vitamin D levels checked? Well, you might want to. Some studies are finding that those with deficiencies may get hit harder by COVID-19. Cronkite News reporter Jackie O'Neill tells us what you should know about the so-called sunshine vitamin.
Your body makes some vitamin D when skin is exposed to the sun, but 40% of Americans are deficient, and people with darker skin have a harder time producing enough vitamin D. I talked with experts about the role vitamin D may play in the lessening of the severity of COVID.
Dan Matijevich is a naturopathic physician at Healthy Habit Health Foods in Central Phoenix. Matijevich says that when patients are tested for vitamin D levels, they're often lower than where they should be for optimum health.
Most people here, Arizonians, are deficient in vitamin D, even though we have more sunlight than anywhere else in the country. So regularly in our clinic here, when we run vitamin D testing, people are consistently lower than where they need to be.
Over 200 scientists and doctors have signed an open letter urging health professionals to help eliminate vitamin D deficiencies to fight COVID-19. Dr. Vatsal Thakur is one of the leading advocates.
There's been dozens of studies that have confirmed this correlation, and there's even now studies that have shown randomized controlled trials that show high-dose vitamin D supplementation actually improves the course of COVID-19.
Vitamin D helps the body absorb calcium and decreases inflammation while boosting the immune system. You can get some from fortified foods, fish, or sunlight, but usually not enough.
A lot of the population is deficient. Around 40% of the US population has a vitamin D deficiency. The things that predispose to having a deficiency are dark skin. My skin requires more more sunlight to manufacture the same amount of vitamin D as someone who has white skin.
Besides supplementation, the amount of melanin in our skin also contributes to vitamin D levels. Dr. Roger Schwelt is a pulmonary and critical care doctor who supports more attention to vitamin D supplementation. He notes that people of color have higher rates of COVID and lower levels of vitamin D.
We're starting to see clearly that people of color are disproportionately hit, and they are, by the way, also disproportionately have lower levels of vitamin D, which is one of the reasons why there are a number of societies now, especially in the south portions of the United States, that are in charge of and working with people of color and health plans to make sure the message gets out that they should really look at supplementing with vitamin D.
At Healthy Habit Health Foods, increased public awareness about vitamin D levels and its relationship to COVID-19 has caused a boost in sales.
Vitamin D is consistently one of the best-selling vitamins since March of 2020 because people are finding out how important it is for preventing all kinds of infections, not just coronavirus infection or COVID-19.
If you're concerned about your vitamin D levels, a simple blood test can show if your levels are too low. You can go through your doctor or purchase an at-home testing kit. In the broadcast center, Jackie O'Neill, Cronkite News.